AVM is, the full name is arteriovenous malformation. Essentially that there are abnormal connections between the arteries and the veins of the brain.
So normally the arteries carry blood up to the brain and then end up in very, very tiny capillaries. And that's actually the place where the blood is feeding the brain with nutrients and oxygen.
In an arteriovenous malformation, those capillaries don't form right, and so the artery is connected to the vein either directly or through some relatively small abnormal blood vessels. And the problem with that is that those small abnormal blood vessels can be weak.
And so they could burst anytime. And when it bleeds, it creates pretty large pressure that results in very bad headaches, nausea, vomiting, or sometimes the patients just become unconscious.
And depending on which part of the brain is injured, it can cause weakness on one side of the body. It can cause problems with language or loss of vision. And that is an emergency. And so we're making those diagnoses in the emergency room. In other cases, people find they have an AVM because they have an imaging study for some other reason. Say they hit their head and they get a CT or an MRI and they see an AVM. In those cases, they often don't cause any symptoms. So it's a real surprise when people find out that they have an AVM.
There are three ways to treat an AVM. One is open surgery. Two is gamma knife radiosurgery with radiation. And three is endovascular treatment. To do open surgery for AVM, we'll remove part of the bone, open up the covering of the brain called the dura. Oftentimes, if the AVM is on the surface, we'll be able to see it quite immediately. The goal of AVM surgery is always remove the connection of the arteries to supply the AVM. And once the input and the output is disconnected, the AVM would come out very nicely.
Another approach is radiosurgery. Radiosurgery is a treatment in which we direct radiation just to the AVM itself, not to the other parts of the brain. And what happens over time is that AVM responds to that radiation by shriveling up, so the blood vessels close. And then the third treatment option is something we offer as an additive piece, and that's endovascular treatment.
We're able to access the blood vessels either through the wrist or through the thigh, and then navigate small, thin catheters up into the blood vessels in the neck or in the brain. Then, if an AVM, particularly if it is already ruptured and there's been bleeding in the brain, we will put in glue, and I'll seal off the big connections to make the surgery to resect the whole AVM easier and safer.
Open surgery for AVM is oftentimes the first option. That's the probably most direct, most immediate, meaning that once we take it out, the chances of a rebleed is very, very small. Now, there's some downside to surgery. One is it's a little bit more invasive because we have to open up the brain. And sometimes it's not a good idea because the AVM is in important parts of the brain that could result in severe neurologic damage.
Radiosurgery has the advantage that we don't have to have an open surgery, but it does take a long time before the AVM is cured, on the order of 1 or even a few years before the AVM completely goes away.
Let's say if there's an AVM that was discovered incidentally before it's ruptured and is an area that is next to the area of speech, for example, then radiosurgery is a great option.
Sometimes if an AVM is very large and it's not safe to be treated by one of the options we've been talking about, the best thing to do is to observe. In those cases, we watch carefully and follow a patient over time.
One of the benefits of doing AVM surgery at UCSF is that we have what's called the hybrid OR room, where we can do the AVM surgery, but at the same time complete an angiogram before we completely finish the surgery.
So an angiogram is just a picture of the blood vessels in the brain. You can see the movement of the blood from the artery through capillaries or through a malformation to the veins.
So that has a benefit of allowing us to make sure that the blood flow of the brain is back to normal. So we know 100% that the AVM is taken out before we complete the operation. How long the recovery process is after AVM surgery, of course, depends on whether the patient comes in ruptured or not. If this is an unruptured AVM, treatment of that should really be a pretty straightforward thing. We expect him or her to be in the ICU for 1 or 2 days and then be in the recovery room for a few days and pretty much can go back to normal activity after a couple of weeks. Now, if the patient comes in ruptured, sometimes is very variable as to how long that recovery process takes.
One thing I tell families is that this is going to be a marathon, not a sprint, but there can be a lot of hope. One of the things that we can offer at UCSF is inpatient rehab stays. So kids who are seen in the hospital can be evaluated by a rehab team as they're coming out of the ICU. We have a great group of physical therapists, occupational therapists, and speech and language pathologists who can really help a child recover as they're making that journey towards getting better.
One of the great things about working at UC San Francisco is we're a big team. I've had the privilege of working with several of my colleagues who are just stellar physicians who are experts in their own area. But when we combine our expertise, that's when we're really at our strongest. And that's where I think UCSF's quality really shines through.
We do have much higher volume than many of the comparable pediatric neurosurgery centers. You want people who do this all the time to be treating your child, and the volume definitely matters.
One of the things that we always say is that kids are not little adults. Their physiology is totally different. Their needs are different. There are a lot of places that have experience in treating adults with stroke, and there are a lot of places that have experience in treating children. UCSF is a special place that can bring both of those pieces together in order to take care of your child.